Following the Trust consultation around its new 5-year strategy, where we spoke to a lot of staff and a lot of patients and service users, there was a real clear feeling that we needed to do more to bring the skills of the two services together to develop better services for patients overall. Well, once we'd done the consultation on the strategy, and that was the clear message from staff and patients, well, why not do it now? So there's been a bit of a consultation about how we approach it. There's been a lot of work over the summer about developing the two teams working together from the two divisions, and 1st of October seems to be the best date to start. I want us to be seen as the provider of the best healthcare services for the people and patients of Nottinghamshire and Nottingham City, with staff confident about looking at new ways of delivering services and engaged constantly in developing them. For mental health patients, there'll be much more consideration and knowledge about how we help them with managing their physical healthcare condition. Equally, for people who've got a long-term condition or who are getting more frail and elderly, actually they're better able to think about and manage their own condition and be more confident as it changes. And also I think for children and young people, I think we've created a really stressful society for them, and hopefully giving them the skills to be able to handle those challenges will give them better futures as well. For staff, I think it will give them more permission and freedom to talk to others about how we could do things differently. I think there's been a bit of a divide between the provision of physical healthcare services and mental health, but staff seem really excited about the idea of being able to share their skill sets better and to have more chances to look about how they could do more things better for patients. To make sure that actually it's business as usual, that we continue to provide the current high quality services that we do for patients so that there's no drop in standards, but also giving staff the chance to start having more conversations about what could we do differently. Equally, we're into the beginning of the planning for next year and this development of clinical services, and I think it's a great chance for people to think about what we could do for next year. Staff should be focusing really on patients and what they're doing now, but also thinking about, well, what is it that we could do differently? Who do I need to speak to? Who would I like to be engaged with in talking about that? Not just within the Trust, but also outside the Trust with other stakeholders, so people from social services, from the third sector, and from primary care and acute hospitals, so that we can start to provide patients with better holistic care. I know we've got challenging times ahead of us for the health service, but actually I think staff have got some really great ideas, are really imaginative, and actually this is an opportunity for people to think about doing things differently and doing it better for patients.